We'll go ahead and call this hearing to order. I appreciate everyone being here. The Small Business Health Options Program, or SHOPS, are marketplaces created by the President's healthcare law specifically for certain qualified small businesses to shop for, compare, and enroll in a health insurance plan for their employees. The Obama administration established high expectations for the SHOP exchanges. In an all-out media blitz both before and after enactment, the administration promised the SHOP exchanges would expand health insurance coverage options for small businesses, that would increase small business purchasing power, lower costs, and give consumers, not insurance companies, control over their health care. Unfortunately, like too many of the President's other promises regarding the health care law, the reality experienced by small businesses is far different. Take, for instance, the promise that SHOPS would expand health insurance options for small businesses. But then the administration announced only one option would be available, the exchanges. And since enrollment in the exchanges began, millions of Americans and thousands of small businesses have received cancellation notifications from their insurers. Nor have the SHOP exchanges simplified the process in obtaining health insurance for small businesses. On November 27th, the day before Thanksgiving, the administration announced that online enrollment through the SHOP web portal would be delayed until next year. Perhaps the greatest disappointment for small businesses has been the impact of the health law on the cost of insurance. The administration anticipated that the health law and the SHOP exchanges would lower health insurance costs for small businesses. But instead, small businesses are reporting significant increases in the cost of providing health insurance. Just last week, a witness from this committee described a 44% increase in the cost of her business's health insurance plan. In other words, access across multiple measures established by the administration, the SHOPs have failed to expand health insurance options for small businesses, and they have failed to reduce the cost of health insurance, and they have failed to give consumers more control and choice over their care. In closing, I want to thank Mr. Cohen very much for appearing before us today, and I now yield to Ranking Member Velasquez for opening statement.
Thank you, Mr. Chairman. Just about every employer and employee knows there are few issues of greater importance than access to health care. Before the Affordable Care Act was enacted, the rising costs of health care were regularly cited by small firms as one of their biggest worries. Health reform addressed two of the chief problems small businesses face in purchasing health coverage: lack of choice and skyrocketing costs. In fact, HHS recently reported that in 11 states, premiums were an average of 18% lower than the amount small firms paid prior to the law's enactment. Much focus lately has revolved around the individual marketplace that can help uninsured individuals purchase qualified health plans. Unfortunately, less attention has been paid to the Small Business Health Options Program, commonly referred to as the SHOP exchange. This marketplace was designed to provide an array of affordable, high-quality health insurance plans for small employers and their employees. Business owners demanded more options in the health insurance marketplace, and the SHOPs provide those options while also driving competition. It is essential that competition remains vibrant in the health insurance marketplace because when it declines, premium costs generally go up. The SHOP marketplace addresses this issue by encouraging competition, but also guaranteeing high-quality health insurance. This new exchange marketplace provides benefit to owners and employees alike. SHOPs make it possible for eligible small businesses to provide qualified health plans to their employees and even take advantage of tax credits. Employers have more control over the coverage they offer and how much they contribute to employee premiums. Employees get the peace of mind knowing they receive the benefit of new market reforms like preventive care and not being excluded because of pre-existing conditions. One study recently found that employers like features of the SHOP exchanges, including getting one bill, writing one monthly insurance check, and easily comparing plans. Still, the implementation of SHOPs has not been without its problems. Several delays with employee choice and the website have led some frustrations for all parties involved. Although there have been bumps in the road, optimism remains high because of the long-term benefits the shops will bring. Today's hearing will give us the chance to hear about how this marketplace is helping small firms and their continued implementation. We have already seen per capita healthcare spending grow at its lowest rate on record for any 3-year period and less than one-third the long-term historical average since 1965. This finding demonstrates just how critical it is to keep an open dialogue to ensure the success of the shops for the sake of small firms and the entire healthcare market. Our witness today will help us understand how shops are working for small firms and how we can continue to move forward with meaningful solutions. I would like to welcome Director Cohen for taking time out of his busy schedule to join us. I'm sure he will provide the committee with valuable insight. Welcome, and thank you for being here.
Thank you.
I yield back.
Today's witness is Mr. Gary Cohen, who's the Deputy Administrator and Director for the Center for Consumer Information and Insurance Oversight at the Centers for Medicaid and Medicare Services. His office is responsible for overseeing and administering the health insurance exchanges and other aspects of the healthcare law. Prior to his service with CMS, Mr. Cohen served as the Chief Counsel to the California Health Benefit Exchange Board. Mr. Cohen, we very much appreciate, again, you coming in before the committee today, and your written statement will be entered into the record. And now proceed as much time as you need.
Thank you, Chairman Graves, Ranking Member Velasquez, and members of the committee. I appreciate the opportunity to discuss the many benefits that the Affordable Care Act is providing and will provide for small businesses and their employees. The Affordable Care Act is transforming the insurance market for small employers, making it easier for them to find and purchase employee health coverage that serves the needs of their employees and is affordable. It's important to remember that the reforms that are in the Affordable Care Act, some of which have already gone into effect and the remainder will go into effect with plan years beginning January of 2014, are not limited to the shop. We have transformed the entire small group market, whether the products are purchased inside the shop or outside the shop. So I want to talk about that because I think there's sometimes some confusion that in order to benefit from the reforms that are in the law, you have to buy a product through the shop. You do have to purchase through the shop to be eligible beginning in 2014 for the tax credit that certain employers may benefit from. But other than that, the same reforms apply whether you're talking about products inside or outside. So historically, small businesses have been charged from 10 to 18% more for the same benefits compared to large employers. Small businesses employing women or workers with chronic or high-cost illnesses or with pre-existing conditions have faced higher insurance rates in most states. Because small firms have fewer employees to pool than larger firms, premiums can vary dramatically from year to year. So when we hear about employers who are concerned because they are looking at premium increases, one thing that they need to bear in mind is that although their premiums may be affordable this year, if one employee gets sick and has a serious illness, those premiums can skyrocket. There was nothing in the law before the Affordable Care Act that prevented insurers from dramatically raising rates on employers based on the experience of their small pool of employees. So one employee getting sick could cause the rates to increase dramatically. That can't happen anymore under the Affordable Care Act because health status is not allowed to be taken into consideration when determining rates. That makes rates for small employers much more predictable and stable than they have been in the past. Now, as I mentioned, the Affordable Care Act created the Small Business Health Care Tax Credit to help small employers of lower-wage workers get a contribution to help them pay for workers' premiums. An employer may qualify for a tax credit if it has fewer than 25 full-time equivalent employees who make an average of less than $50,000 a year. Now, the tax credit's been available already since 2010 in the amount of 35% of the employer contribution. It goes up to 50% for policy years beginning in 2014. Since the tax credit became available in 2010, it's been worth It's provided hundreds of thousands of small businesses more than $1 billion in total tax credits. So turning to the shop, because the shop, as I mentioned, is the place where these smaller employers with lower wage workers have to go to be eligible for the tax credit. There are a total in the federal states where their federally facilitated marketplaces operating, 66 qualified health plans that are offering 914 plan options, and there are 106 qualified dental plan issuers offering 511 plan options. In the state-based shops, as Ranking Member Velasquez mentioned, most of the state-based shops are giving employers the option to offer more than one carrier to their employees and letting their employees choose from a number of plans from multiple insurance companies. And we've announced that although we have not provided that option for 2014, in 2015, the federally facilitated marketplaces will provide that option as well. Beginning in August, we launched a dedicated call center for employers to learn more about the shop and to get answers to some of their basic questions on the Affordable Care Act. Since the call center launched, we've received more than 22,000 calls from employers and others who are interested in the shop. And then we've recently we've gotten a lot of calls from agents and brokers as well, wanting to know how to help their clients get enrolled through the shop. So that shop call center also has people who are specifically trained to help agents and brokers with their questions and enable them to assist their clients. One of the most important tasks that we have is to ensure that small businesses understand the new options available to them. So we've worked very closely with the Small Business Administration, which is leading the outreach to small business, and with the Departments of Labor and Treasury. We provide detailed explanations of the shop marketplace and answer questions on the shop as part of weekly national webinars that the SBA conducts, which are hosted by the Small Business Majority and help to educate and increase awareness of the Affordable Care Act and of the shop in particular. We've been providing information and speakers on these weekly webinars since they began in July of this year. In addition, a lot of our outreach on the ground is done through the CMS regional offices. So the CMS regional office has been working with SBA, Labor, Treasury, and groups, stakeholder groups in their communities. And just since September 1st, regional offices have hosted or participated in 20 different events in local communities throughout the country to provide information about the shop and about the small business market in general. Now, recently we announced changes to ensure that small businesses where the federal facilitated marketplace is operating to take advantage of shop coverage and the health care tax credit. So what we've done is we've said that we want to take advantage of the sales and distribution channels that already exist in the market. Most small business owners work through an agent or broker in order to obtain coverage for their employees and to find out what sort of plan is going to be the best for them. And I'm pleased to say that more than 70,000 agents and brokers have been trained to assist consumers in the federal marketplace, including many who have completed a course specific to the shop. Now, at this point, as we've announced that the online capability to shop and get enrolled for small businesses is not available until the fall of 2014 for the 2015 policy period. However, that doesn't mean that there aren't resources available to small business owners on healthcare.gov, and there are. So small employers can go to healthcare.gov, and there is a greatly improved and expanded ability to see what plans are available in the shop, to get a premium estimate based on the specific number and ages of employees who work for that employer, and to get links to the issuer's information. Oh, and on the website, so they can get a premium estimate. They can see the cost sharing factors, deductible, copay, et cetera, and then they can get links to the issuer's website to see more specific information, the plan brochure, provider directory, the drug formulary, et cetera. and as I said, they can then get enrolled in coverage either directly with an issuer or through the use of an agent or broker. So we've updated the materials that we have available both on the website and the materials that we distribute through the various webinars that we have and so forth to announce those changes. We have been contacting directly by telephone and email each and every small business that submitted an application to us, and those contacts have now been completed to let them know exactly what they need to do in order to get enrolled through the shop, and particularly if they're eligible for the tax credit. And in sum, for too long, small business owners have struggled to keep up with the ever-rising cost of health insurance for their employees. The Affordable Care Act makes it easier for businesses to find better coverage options and builds on the current employer-based insurance market. The SHOP, combined with new insurance reforms and tax credits provided by the Affordable Care Act, gives employers new options to provide their employees with high-quality, affordable health care coverage. I look forward to continuing to work with you to improve the health care options for American small businesses, and I'll be happy to answer your questions.
We'll start with Mr. Hulskamp.
Thank you, Mr. Chairman. Mr. Cohen, I appreciate you joining us today. It must be a pretty tough job trying to answer these questions, and I'll start with perhaps a little bit of background. As I understand correctly, that you have testified at least 4 times earlier this year that the healthcare.gov website, of which shops are a part, would be up and running by October 1st, 2013. Can you explain what changed since you made that testimony, that what you didn't know, and why the shop enrollment has been delayed for an entire year?
So, I think obviously everyone knows, and it's been extremely well publicized, that when October 1st came, we ran into a number of difficulties and problems that were unanticipated. And at the time that I gave that testimony, I was providing the best information that I had based on
And I appreciate that, and you're giving that information. But what is confusing to me, Mr. Deputy Administrator, is that when I listened to Catholic Secretary Sebelius, she blamed it on the contractors and folks not in her direct supervision, and that somehow she was shielded from being able to make those decisions. Were you involved personally, or your office, in making those decisions? Just trying to figure out where the mess up is so we can find a way to get the shop online instead of waiting another year. Couldn't we do it a little more quickly?
And so what I would say is this. CSIO is what I would characterize as the business owner of the marketplaces, including the shop. And we have been instrumental, obviously, in providing the regulations and the guidance and setting forth the rules, essentially, for how the exchanges are to operate and the shop is to operate. I will say, and I hope you won't take this to be trying to duck the question, the people who built the website don't report to me.
Who do they report to then? That's where I'm a little confused.
So obviously we had contracts. The contracts were supervised by people in CMS and its Office of Information Services, and those people report up to the Chief Operating Officer of CMS and ultimately to the Administrator, Marilyn Tavenner, but they're outside of my organization.
How many Deputy Administrators are there?
I want to say 6 or 7.
6 or 7, and it's not in your line. So, but it goes directly up to the administrator, who then
Yes.
reports directly to the secretary.
Yes.
About that. So, when did the folks in your line find out about the shops and the fact that they weren't going to make it by the deadline?
So I know that, and I was involved in conversations as far as what the functionality of the website was going to be into September. And we were pushing very hard to get as much of the functionality to be available for October 1st, and we understood, obviously, that was the target and the deadline. And it was sometime, into September when a decision was made that it just wasn't going to be ready for October 1st, and we announced at that time that it wasn't going to be ready for October 1st, and we were hoping to get it implemented in November at that point.
So with that failure, how many small businesses do you now project will receive the tax credits for 2014?
I actually don't have an estimate of that number.
Does anybody over at CMS, or that's?
I'm not certain. I can look to see whether we've come up with that estimate, but I actually am not aware that we have at this point.
Well, as you can guess, we hear a lot of discussion in the committee of how helpful those credits will be. Trying to get a sense of how many might even qualify for that. And the purpose in this committee is to promote small businesses, and this hopefully was going to provide an opportunity for comparison shopping, more access for these small businesses. But as of now, we have really no idea, given the failure to meet the deadlines, of how many would actually be taking advantage of this.
So, yeah, so I would say it would be a difficult. Just thinking, it would be a difficult number to come up with. I don't know myself, and there may be research on this, how many employers would actually even be eligible for it. Having 25 or fewer employees, 50,000 average, a wage. And then you'd have to make some assumptions about how many of those employers even want to offer health care at all, because many don't.
Right, and I understand that. And that was
Yeah.
the difficulty of the administration trying to predict that. Obviously, everything's changed with the failure to meet the deadlines, and just trying to get a sense. All those numbers should have changed as well.
And we've tried to, as I said, we've tried to, recognizing that we were not able to provide the online experience, we've tried to do everything that we can to make sure that employers will have access to those tax credits. And the good thing about it is, if there's the silver lining, is that unlike on the individual side where it's an advance payment of a tax credit, for employers it's a tax credit that they claim with their tax return at the end of their tax year.
But
so
if you're in a state with no state exchange, you're left with submitting a paper application to receive these credits.
that's correct.
All right. Thank you, Mr. Chairman. I yield back.
Ranking Member Velasquez.
Thank you, Mr. Chairman. Mr. Cohen, the online experience is lacking.
Yes.
We know that. But also we know that a survey, and I don't know if you are aware, but a survey found that 80% of offering firms use a broker or agent, and firms with 25 to 50 employees are more likely to use one. So the fact that we don't have the website doesn't mean that it will hinder the ability of small businesses to get into the healthcare marketplace.
Yes, I agree. That's right.
Last week, we had a hearing here with a panel of small businesses, and some of them claim that their rates were going up dramatically. And I would like to get your sense as to why these increases are happening. Could it be because they are receiving better coverage than they used to, or do you have any other explanation?
So I would first just point out a couple of things about what's happened to rates, because I think it's also important to keep in mind that since the Affordable Care Act has been in effect, premium rates for health insurance have been rising at the slowest rate in literally in decades. And that's true for a number of reasons. One reason is increased focus on rate review. And we've done a lot in the Affordable Care Act already, both to give grants to states to enhance their rate review programs, and also to provide that any rate increase of over 10% has to be justified by the insurance company, and that justification is made public on our website or on the state's website if the state is doing the reviews. Based on our report that we put out in this year for 2012, the average premium increase for small business in 2012 was only 4.7%. They had been going up at the rate of about 18% a year or more. And in addition, that 4.7% was almost 20% lower than what the insurance company asked for in its initial filing. So that shows that the focus on rate review has really had a direct impact on the extent to which rates are going up. So if employers are facing increases this year, it's from a lower place than they would have been without that. In addition, I'm sure you're familiar with the medical loss ratio provision of the law, what we sometimes call the 80-20 rule. So that says that insurers have to spend at least 80 cents of every premium dollar that a small business pays on actual health care, and only 20% on administrative costs and other. That provision has resulted in substantial rebates to small businesses across the country that in effect reduce their premium, right? They may have paid a higher premium, but then they're getting a refund because the insurer did not meet that 80% standard.
Right.
So looking at the change from, and then, the National Survey of Employer-Sponsored Health Plans that's done by Mercer every year said that the growth in total health benefit cost per employee was only 2.1% in 2013. So we're seeing across the board very dramatic reductions in the rate of growth that historically has been seen in the health insurance market in general and in particular for small businesses. So looking at the increases that some employers are reporting that they are seeing as a result of, just the change from 2013 to 2014. And I would make a couple of comments on that. As everyone knows, the President announced recently a policy that said that issuers could continue to offer the 2013 plans for another year. And a number of states have adopted that program, and another number of issuers have. So some employers who expected to be seeing a change from the non-compliant plans to the plans that will comply with the ACA will have the opportunity to keep their existing plan. And then I think the other, to some degree, it's a change in benefits, although I would point out that the essential health benefits that are required in the small group market were based on the most prevalent benefits that existed in the market at the, as of 2013. So there's not a dramatic shift in the benefits that are available. It's different for the individual market where many people were in, really skinny plans that didn't provide a lot of coverage. Maybe they just covered hospital, but they didn't cover doctor's visits. They didn't cover, so that sort of thing. So in small group, the benefits haven't changed that much. But we have made some changes that, as I said, will result in greater stability over time for rates. So I think that it's going to be somewhat misleading to look at just 2013 to 2014. I think you really need to look at the trend of what's going to happen going forward, because rather than an employer facing large increases, as I mentioned, just because one employee gets sick, that isn't going to happen anymore. So an employer, I think, what I hear from many small businesses is what we need is predictability and stability, and that's what the Affordable Care Act is going to provide. It's going to provide predictability and stability over time without these jumps that have been experienced in the past.
Thank you very much, Mr. Cohen. We've seen the enrollment numbers regarding the individual marketplace, and even with problems, the amount of people enrolling and even just visiting the site remains promising. However, I haven't heard much about the enrollment figures in the shops. Is this data being tracked by HHS? And do you have any access to the state-run shop data? So
as you might expect, because we haven't been taking enrollments online, we don't have those figures in the small business market the way we do on the individual side, where we know because the enrollments are coming through us. So we are going to be receiving enrollment data from the insurance companies, so I don't have that today, but we will be getting enrollment data from the insurance companies. This is for the federal marketplace, and we'll be able to report that out. The state-based marketplaces, some of them have been reporting small group enrollments, and that information should be available.
And when do you anticipate to have the data being reported to you by the insurance company?
The data will be reported to us by the insurance companies, sort of on a regular basis as they're signing people up, and then we'll have to, group that together and come out with a report, and we will do that.
Thank you, Mr. Chairman.
Mr. Tipton.
Thank you, Mr. Chairman. Thank you, Mr. Cohen, for being here. And I'd like you to explain to me and help me to be able to understand. I think that we keep experiencing from this administration bait and switch. You just made the comments that we're seeing rates rising at slower levels than they have over the previous decades that have been going out. Didn't the President promise us that we were going to be having lower rates, not lower rates of increase?
So I think that over time, I expect that will happen. I don't think it's
Your promise
reasonable or
our rates are
necessary.
going to go down?
I think over time, as there's more competition, it's again important to recognize that the health insurance market in many states has been extremely concentrated, and there's been one dominant carrier that has, in some states, as much as 75 or 80% of the market. And I think we're just beginning to see, this is just not even the first year that the Affordable Care Act is in place. I think we're beginning to see signs in some places where increased competition has resulted in decreases in rates.
Okay, so again, this administration is going to make the claim that they're going to ultimately lower rates for Americans. We'd like to be able to hold you to that. But really, this is about fairness. Isn't that what you're trying to say? We want to have it fair for the American people, fair for small business. Is that right?
Yes.
It is. Then perhaps you can explain for me, NFIB, we just spoke to them out of the state of Colorado. If you happen to live in rural Colorado versus urban Colorado, you are paying a premium under the President's so-called Affordable Care Act. Explain to me how that's fair.
Congressman, I think you would find that
no, this is coming from the NFIB.
No, I think you'd find that rates in rural areas have been higher than rates in urban areas historically.
It's
not
new.
New.
It's
that's
fair
not
to
new.
punish people who live in rural America?
No, not at
where
all.
Wages are lower, where access is lower. The administration's comfortable with that?
I'm just saying it's not because of the Affordable Care Act. I'm saying that it's because of a number of other factors, including the cost of providing medical care.
The Affordable Care Act coming out of rural Colorado, you can be paying anywhere from 65 to 100% premium just because you live in a rural area. That's where a lot of small businesses in my area come from. How's the administration helping them with this policy?
So I think that with increased competition, we are hoping that there will be more issuers offering health coverage in both rural and urban areas, and that will have, what we've seen is if you look at states where there's more competition, rates are lower. When you look at states where there's not a lot of competition, rates are higher. That was true before the Affordable Care Act, and that's something that we expect to change over time. But the discrepancy between medical costs of providing medical care in rural and urban areas is not new or something that was caused by the ACA.
That's not what the President promised us when we were talking about introducing this now law on the American people. They were going to lower our costs. We're seeing rural Americans suffer in our areas, our small businesses seeing their costs go up. And I've got to tell you, Mr. Cohen, this is very disturbing coming from a rural area with a lot of small businesses. The lack of compassion that this administration is showing for these small businesses. How many small businesses have canceled those policies now that the President unilaterally made the decision to extend it, not giving it to individuals, by the way, but to small businesses as he gave favor to big business earlier on? How many businesses canceled policies? Do you know?
I don't know. But
you don't have any?
But I think it's important, just in reference to what you just said, the requirement that employers offer coverage does not extend to small businesses in the Affordable Care Act. It's only to large employers. So there's no connection between those two things. It's always small employers' choice whether to offer coverage to its employees.
I'm going to run short on time, but you keep inserting the word, we hope something's going to happen. We hope the website's going to work. We hope we're going to be able to lower costs. Doesn't give a lot of comfort to many of us, but you keep pointing to the credits. Small business guy, who pays for the credits that are going to be issued by the government?
These are tax credits, and it's ultimately it's paid by the Treasury and by the American people.
Who provide? So the American people get to pay for. So actually, there's no real net savings. Sooner or later, somebody's going to be paying the bill. Is that accurate?
I think as with many things that taxpayers pay for, there will be a benefit to society as a whole for making it possible for small businesses to provide health care coverage to their employees. We all benefit when people are
So the American
healthy,
people will
are
pay for it.
productive, and have good access to health care.
Federal government mandates, the American people pay, small business suffers, and people in rural America perhaps the most. I see my time's expired, Mr. Chairman.
Thank you, Mr. Schrader.
Thank you, Mr. Chairman. Appreciate the opportunity. Mr. Cohen, thanks for being here.
Welcome.
Is there a requirement for any small business under 50 employees to provide health care to their employees?
No, there's not.
And how many businesses, small businesses in America, would you estimate are small businesses with under 50 employees?
I actually don't have that figure. I mean, I'm sure it's available, but I don't have that figure.
Well, I'll tell you, it's well over 95%. And so most businesses, push come to shove, whether a website's not working or not, really totally unaffected by this website not working. And I guess I'd ask you personally a allegorical question. I mean, how many times does your computer work perfectly and every new update you get worked the way you anticipate?
I think it's, Congressman, we're all quite familiar with circumstances where we go on a site and it doesn't work.
Fair question. I appreciate that. Is there anything that prevents small businesses from getting health care because of the ACA? Can they still shop for health care through an agent?
Absolutely.
And how many small businesses you think, the ranking member alluded to this, but how many small businessmen and women spend a lot of time thinking about health care plans and which one to get for themselves and their employees when they're trying to run a business, sell a product, and really trying to move the economy and create jobs? How many small businessmen and women, really do it by themselves, call you up or call CMS, say, hey, I want to get this plan? How many calls you had?
So my impression is that while small businesses are very concerned about the cost of health care and they want to provide health care to their employees, historically and today, they rely intensively on agents and brokers who are experts.
Absolutely. That's the intelligent thing to do, and I'd certainly urge all my small businessmen and women, as well as individuals, to use those agents on a regular basis. You testified the cost of health care for small businesses is already going down. Could you reemphasize that 2012 figure for us, please, and how much less than it was going to be? So
in terms of rates, the average premium increase for small business in 2012 was only 4.7%, whereas before the ACA, rates have been increasing by 18% and more on an annual basis. That's pretty
substantial. As a small business guy, I mean, I jumped around I had a veterinary practice, and I had a lot of different health care providers. I shopped around, my agent shopped around for me to find me the best deal at any given time. And if I found a plan that didn't go up in double digits, I jumped on it. That was exciting to me. And I think you've testified already the fact that we're going to see hopefully more of this going forward, where premiums are up a little bit. And I'll be honest, I concur in one aspect with my good friend and colleague from Colorado, that I don't think we're going to see the rates go down a whole heck of a lot. As a small businessman, I'm a realist. I just want the rates to go up minimally. I mean, I can't get a car for the same price every year, can't buy my house for the same price every year. Everything goes up over time. It's a question of how much does it go up. Right now, healthcare costs prior to the ACA have gone up at double-digit rates that are breaking the back of small businessmen and women. The only game in town, because the other team has not put anything on the table, the only game in town to reduce healthcare costs for small businessmen and women is the ACA. The pooling you referred to, I think, is critical. And while I got a lot of rural folks in my area, too, I think that I choose to live in a rural area. I have a farm myself, and I don't expect I'm going to get the same rates that some of my colleagues do. But I do know that with the pooling, my rate's going to be ameliorated quite a little bit going forward. Any comments?
Yeah, no, and thank you. And if I might, you remind me that I should always stress when we talk about what's happening with rates. I think we all understand that the predominant factor that causes health insurance rates to go up is the cost of delivering health care. That's the main factor that causes it to go up. So we need to work together to bend that cost curve down, to improve access to health care, to eliminate uncompensated care, which is a tax on every single American, because we all end up paying when people show up at the emergency room and don't have insurance. We all end up paying for that. That goes into the rates that the hospital charges, the doctor's charges, and then gets put back in the rates that insurance companies charge to us. So that's not free. And so we need to focus on what we can do to attack the increase in costs of delivering health care. But as you have said, Congressman, we need to bear in mind that those costs do go up year over year. And they have continued to go up. They've gone up by significantly lower amounts since the Affordable Care Act was passed. But when we talk about rates being lower, we have to be somewhat realistic that there are certain costs that are baked into health insurance rates that are due to, what it costs to provide the actual underlying health care.
Well, it's working in my state. In Oregon, the rates are much less than what a lot of people thought would be filed. I'll yield back. Thank you, Mr. Chairman.
So, Deputy Administrator, has the rhetoric changed now? Because now you're talking about, and we keep hearing all this talk about rates not increasing as much as they were, but didn't the President say rates were going to go down?
Well, I think that we have seen in some places rates actually going down. In New York, for example, they went down rather dramatically.
Really?
Yes. But it varies a lot from state to state, depending on the laws that were in effect in that state prior to the Affordable Care Act, which varied considerably from state to state, and depending on the nature of the market in that state and how competitive it is. So I think it's hard to make a general statement about what it's like everywhere and for everyone. But I continue to believe that as this law becomes fully implemented over time, and as we see greater competition, that will have an effect on reducing rates overall, bearing in mind that there are certain factors of inflation that are always going to be part of the cost of providing health care and, salaries to insurance company employees, et cetera, et cetera.
Well, I find it fascinating that the rhetoric has changed. I mean, you're hoping for that now. We heard all this talk about how rates were going to go down for small businesses, but now we're talking about rates just not increasing as much. And you stated just a few minutes ago, you said the ACA was bringing predictability and stability. Those are your words to small business. And, I still have to, when you talk about predictability and stability, how do you get predictability and stability when you continue to put these deadlines off? Administrator Tavenner stated on October 29th in a hearing before the Ways and Means Committee that the online enrollment for the federal shops was going to occur at the end of November, and that things were moving along nicely and are going to be ready to go in less than a month. Now, how do you go from that to we need to delay it for 1 year, and how does that bring any stability, in your words again, stability and predictability to these small businesses out there that are trying to make decisions?
Well, I would just say again, I don't believe that the availability or lack of availability of the website and the ability to access the application, et cetera, online is affecting the rates that people are paying. I mean, the rates have already been filed, established.
I'm talking about predictability and stability.
Well, that was my comment. My comment was that there will be more predictability and stability for small business owners in terms of the rates that they're going to have that they will pay to provide insurance for their employees, because they won't be subject to dramatic changes in the event that an employee is diagnosed with a serious illness, and then they're faced with the situation, and I've heard this directly from small business owners, I either have to let that person go or I have to stop offering health care because I can't afford the premiums for that one person who has gotten a diagnosis of cancer or of some other terrible disease that's going to dramatically raise the cost to that employer.
Well, there is no predictability or stability in this whole process of trying to even find out what your rates are going to be or getting enrolled in that process. It is very frustrating. We hear from small businesses all the time about the uncertainties. And, we use that word around here all the time, uncertainty. And this has been the epitome of uncertainty, to say the least. Ms. Meg?
Thank you for being here. As we know, there's a lot of misinformation circulating, much of it purposeful, that is leading to a lot of confusion within the small business community. I represent a large a district in Queens, New York City that has many newer American small business owners and entrepreneurs. What is being done to reduce a lot of the misinformation and get the truth about the law out there?
So thank you. We're trying to do as much outreach as we can. As I mentioned, a lot of that is done in connection with the Small Business Administration, and we have these national webinars every week for small business where we provide information about the Affordable Care Act and about the Small Business Exchange. In addition, we've done, we have email listservs that we put information out, so any small business owner who comes to healthcare.gov can sign up to get email information from us, and we've been putting out information through that channel. We've been doing public service announcements as well on the radio to help provide additional information. We have a significant effort out in the states through the regional offices that have been holding a large number of educational and otherwise informative events for small business. And then we have a dedicated SHOP small employer call center that is available to any small business person who just wants to call and get information about the ACA in general, or more specifically about the options that might be available to him or to her. And that SHOP call center, when you call in, there's a prompt on the line. If you're an agent or broker, you can get directed to somebody who is specifically trained to help answer questions for agents and brokers, to help them with their small employer clients, and we've been doing specific webinars, again, directed at agents and brokers to help them. And then finally, I would say, particularly over the last several weeks, given the decision that we made about not having the online capability available, we've been working very closely with the agent broker trade associations, with NAHU, with the Big I, and with the CIAB and others. And I've met with them myself, with my staff, to make sure that they can push out to their members information about how to access coverage using the sort of the traditional channel of going through an agent or broker. So we've done quite a lot, I think. Obviously we can always do more, and we want to make sure that everyone understands, as we've been talking about, that there's nothing about the fact that this online shopping experience isn't available that prevents any small employer from getting coverage or prevents any small employer from getting a tax credit if they're eligible for it.
Thank you. And we saw in Massachusetts that many people didn't get coverage until closer to the deadline. Do you anticipate the same to be true this time around, and how will year-long enrollment benefit the small firms?
So that's a great point, and I think that it's important to recognize that, first of all, there is no open enrollment period for businesses, so businesses can actually sign up throughout the year at any point in time. And my understanding is that, in fact, small business policies do run, at any point throughout the year for a year. So while there may be a somewhat larger number coming, in January, it's actually, throughout the year. There's no particular magic to January 1st as far as getting coverage for a small business, and no particular magic even to March 31st, which there is for in the individual market. Small business owners can apply for and get coverage throughout the year. So while I think on the individual market, everyone is expecting that we'll see a spike here in December for January 1st, and then we're likely to see kind of another spike in March as we approach the end of open enrollment. I think for small businesses, because their current policies will be ending at various points in time throughout the year, it seems likely that we might see more of a steady rate than in the individual market.
Thank you. I yield back.
Mr. Collins.
Thank you, Mr. Chairman. Mr. Cohen, you made a statement that I just want to make sure I understood this correctly, that I'm from New York, and I own 7 businesses, small businesses. You said that in New York, insurance premiums for small business are going down. I think you even said dramatically down. I'm not misquoting you, am I?
So the question that I was asked, I'm not sure was specific to small business. I think we were talking about rates overall. And I'm familiar with information that the New York State Insurance Commissioner has put out once the plans were announced and the rates were announced for New York. I actually, in fairness,
Okay. We're here talking about small business, and just to clarify, the ones you're talking about, I believe there were 100,000 individuals out of 20 million where the rates went down, and the insurance commissioner quoted the statistics for those 100,000 individuals. There's 19,900,000 other New Yorkers that statistic didn't apply to. So I would suggest you check your data. As a small business owner and in the midst of insurance renewals right now, the increases are staggering, and they're staggering because of the Affordable Care Act, because of Obamacare. So again, you're right that if you have less than 50 employees, offering health insurance is not mandatory. But my world says, and I hope you agree, if a company offers insurance, that's a good thing.
yes.
And it shouldn't be one size fits all, should it? I mean, I have a company with 12, I mean, we had someone in here testifying, and don't laugh, but the name of the company was College Hunks Moving Junk. And these were young, healthy adult males. And I asked the question, do your employees need maternity coverage? And after a few snickers, the answer was no. But don't they have to provide that now? They can't have a plan that doesn't have maternity coverage.
So I actually don't know whether New York State already required maternity coverage. Many states did. What I can tell you is that the essential health benefits were based on what was the most prevalent small group plan in the market.
So one size fits all. So if I was an employer and I had a good plan that my employees liked, and it didn't have maternity care, I can't offer that plan. It doesn't meet the essential benefits.
Well, under the policy the President announced a few weeks ago, you could still sign up for that plan. But you're right.
Well, no, you're incorrect, sir. In New York did not offer that option. I'm from New York.
So in New York, you're correct.
We do not have that option. But my point is, if I had 20 employees and they were healthy and they didn't need or want to pay for prescription drug coverage, which I happen to know one of those companies, and the employees were satisfied with that coverage, let's face it, a lot of drugs are generic, then there was a company didn't have to provide coverage, did provide it, provided it at an affordable rate, and all of a sudden now they can't offer that coverage anymore. And in some cases, prescription drugs could be 40% of the cost of health insurance. And the employees don't need it. But now the government's saying, and in these cases, the company may not offer it. So they had a good plan, worked for the company, worked for the employees. They can't offer that plan. One that meets the essential benefits is up 40%. Now they get no plan. How is that good for that family? Those are facts.
The law provides that if people have health insurance, it should be health insurance that's actually going to pay for the needs that they have.
These people didn't need prescription drugs.
Well,
they didn't need them. And that they were young.
They have no way. They may need prescription drug coverage. You know. And
I know.
So,
Washington knows best, sir, but I don't believe Washington does. Now, another thing you said, and I just take issue perhaps with some of your statements. Are you telling me, because I think you did, that if I had 6 employees, I have an experience-rated plan, and if one employee gets sick, then my premiums could skyrocket? To the best of my knowledge, if I have 6 employees, I'm in a community-rated plan. I'm not in an experience-rated plan.
not in every state. That's not true. Maybe true in New York, but not in every state.
Well, so again, you
There are
made a
states that-
blanket statement, but in New York, I'm in a community-rated plan. In fact, if I have less than 50 employees, I can assure you, I'm in a community-rated plan. I don't bear any risk whatsoever, not one risk whatsoever, if an employee has a serious illness, hundreds and hundreds of thousands of dollars of expenses. My premiums don't go up. I'm in the community-rated plan, but yet you made a statement that made it sound like the ACA was the end-all for employees that, companies that offered insurance. And again, let's talk about New York. That's not a true statement at all.
We are trying to provide that exact same benefit, which you are saying is a good thing, to people across the country. That's the idea, is that employers across the country should also be free from having skyrocketing health plans. I mean, the states vary. There's no question about that. And we are providing a level of
Well, my
security
time's expired,
for-
but I would like to just point out, to clarify, New York, you can't keep your health plan. In New York, if you're under 50 employees, you're not experience rated, so there's nothing in the ACA that's helping us, helping that employee, which you used as a very stark example. And I can assure you that a lot of employers and employees liked the health care they had. They can't keep it anymore, and there are things that are considered essential. They didn't think they were essential, and now they're not going to have insurance, and they're going to go home and explain to the wife and the kids why they don't have insurance, because the government told their employer what they had to offer. Now they can't afford it. That was not a good day at the dinner table for that family in New York. Thank you.
Mr. Schneider.
Thank you, and Deputy Administrator Cohen, thank you for making the time to be here. I know I owned a small business with a partner from 1997 to 2003, and we faced increasing health care costs year after year, double-digit increases, having to make very hard choices about how much we could provide for our employees, what would be the best to serve them. It is a challenge we have faced for a long time. It is a challenge. Our health care system is a challenge that if we don't address it for the long term, it's going to affect decisions we make in businesses and government for a long time to come. As you touch base on your comments, and you talked about business owners struggling to keep up, like I did with my partner a decade ago, what do you see as the most important aspects? How do we make more people aware of the advantages or opportunities they will have once we get through the challenges presently to use the Affordable Care Act, the law as it stands, to better provide health care for their employees?
So I think what I've heard from a number of small business owners and stakeholders and associations is one of the things that they point to is the employee choice model, which is available now in the state-based marketplaces and will be available in the federal marketplace for next year, because that does provide something that has not been available to most employees in the past, where an employer could offer a number of different options from, maybe an HMO from one company and a preferred provider plan from another, and employees can make a decision based on their individual needs what sort of coverage is best for them.
As companies try to weigh their choices, we're seeing in different states, some states are ahead of others, but small businesses, many of them are trying to compete on a national scale. What are you going to say to the companies who don't have the options today? What should they be doing to prepare for or make sure they can continue to provide their employees health insurance?
Well, I mean, I think they should definitely shop and look at all the options that are available, either as we've talked, going through an agent or broker, or mention again, employers can go on healthcare.gov now on what we call the learn side, so not the application side, but the learn side, and see all of the plans that are available to them through the marketplace, and can get a premium estimate and look at the cost-sharing options. So I think, as with anything, it's a complicated subject, but the more that employers can educate themselves and learn about what options are available to them, and then obviously if they are a smaller employer, 25 or fewer, and eligible for the tax credit, that's something that they should definitely pursue, because that can pay 50% of the employer contribution.
Speaking on behalf of so many small employers who are anxious, who are concerned, I think it's critical that we continue to get this information out, that they understand, but going forward, that the systems we put in place, the steps we take going forward, adapt, understand their needs, and give them the options they need to provide their employees health care. And with that, I'll yield back my time.
Thank you, Mr. Chairman. Mr. Cohen, a couple things just to sort of help me dig into some of the information. And I know some of the frustration you're going to hear from us as members is sort of based in information coming to us that there were problems with the website and the mechanics and those things, and yet we got a lot of happy talk thrown our direction. And you always wonder how much of that is, professional staff hiding behind politically appointed staff to, it's so often our relationship with the administration seems to be political, not necessarily factual. But I want to back up to where we were before. Talk to me about some of the data you believe you have modeled, because obviously with an organization like yours and what you do, you would be modeling it on first adoption. What are the models you've built for under 50 employee organizations going through the ACA or other mechanics to expand health coverage? Have you built those models?
I'm going to have to go back and look to see what we have, and I'm happy to work with you to provide you with that information, because I just don't have that.
Okay. Well, something that would be incredibly important to your organization, obviously us from a budget mechanic, is also would you have paid attention to expectations of subsidies?
I think that I know on the individual side there have been, we've looked at enrollment, and the CBO published, figures for what they expected enrollment to be and what the costs were going to be. And I'm just not able to call to mind what that was on the small business side. But if we have that information, I'm happy to work with you.
Just plan, we're going to ask you for that, because as we're now seeing much of the data coming at us, it's the dramatic skewing into, on the individual side, into Medicaid plans instead of sort of individual purchases. Now, maybe that changes, but just trying to get our head around what's the budgetary impact for all of us who have to do policy making into the future. Are we about to wake up one day and we've just blown up, future entitlement spending and other spending in this law? So the unintended consequences of something, it has a whole bunch of mechanical issues. Mr. Cohen, or Mr. Chairman, Mr. Cohen, are you familiar with the discussions that have been around the business aggregation rules?
In terms of?
In terms of what actually makes up 50 employees.
Oh, how you count to what? How you count employees to add up to 50?
Yes.
Yes. Yes, I am familiar with the discussion, although that's a Treasury rule. That's not.
A Treasury rule, but don't you end up having to do part of the administration, part of the modeling for what that actually brings in or does not bring in into participation?
Again, I'm not, on the question of what modeling we've done, I would need to go back and see what we have for you on that.
Okay, because last week we actually had some fascinating testimony here of some gentlemen sitting at that same table saying, we have a small business, we actually offer health insurance on our little business, but I'm an investor in this one, and I participate in this one, and I do this one, and oh my heaven, everything else I'm touching now is going to get pulled in under this business aggregation rule. I am better off not investing in my son and my brother-in-law's and my daughter's businesses, because I create a cascade effect and force everyone under that 50-employee rule. And this isn't sort of hitting your radar on what this does both in membership enrollments, future subsidies, and actually the obvious economic impact of that?
Actually, no. I haven't seen anything on that myself.
Okay. Mr. Chairman, Mr. Cohen, Mr. Chairman, can we make sure we reach out to Mr. Cohen and ask them for their data sets of what they modeled in expectation of participation and the subsidies that were modeled to go along with that? And Mr. Chairman, with that, I yield back.
Can you provide us with that information?
We'll certainly take whatever requests you have, and we'll work with you to get you information.
All right, we'll make that request formally. Mr. Luetkemeyer.
Mr. Schweikert asked a lot of my questions, so no, you did a great job as usual. I was looking to try and figure out what the amount of the subsidy would be by the government per year for our small business groups, but you've asked that question, so I thank you for that. Quick question here with regards to most of the other administrative offices throughout the government have got some sort of an ombudsman program or a complaint bureau. Does your office have one for the small businesses to lodge complaints? And a while ago you said something about them being able to go there for information. But if there's a complaint with a policy with regards to a company providing coverage or just the government's participation period, is there a way to lodge a complaint?
So we do, yeah. We do have part of our office that receives complaints from the public.
What part of that is
that? Sometimes there are complaints about what we're doing, and sometimes there are complaints about what they've experienced. They've had a problem with the health insurer or something like that.
Okay, so if I'm an insured and I have a problem with the company, who do I contact?
We have a phone line that you can find, on our website.
It's on your website. The number's on the website that
so,
identifies it as a claims complaint line. Is that
yes,
right?
and then there's healthcare.gov call center is really the focus now for most of the questions that are coming in.
Healthcare.gov, isn't that the one where everybody goes to try and get signed up that's not operating?
Well, no, but the call center is operating, and we have literally thousands of people who are answering phone calls every day from the public.
You're incorporated with that line?
Yes.
Small business line is?
And we have a dedicated small business call center as well that small business owners can call to ask questions or make complaints.
That's troubling. I'm concerned that we've discussed and thrashed this around a little bit with regards to the increases in coverage, in cost of coverage, and I've got a little bit of insurance background, and my history is such that people, as long as the price is affordable and they don't have any problems, they'll continue to take it. When it becomes unaffordable, they will drop it. Or if they have a situation where they can't get coverage, they have an illness that now is a pre-existing condition, for instance, that can't get coverage someplace else, then they will keep it. And as a result of that, you wind up with adverse selection, which means the people who have the most to gain are the ones who stay in the program. The ones who have the most to lose will get out. And as a result, your premiums will go up accordingly. You don't think that's going to happen? I mean, that kind of is the assumption I get from the discussion you've had so far.
And is the question whether that will happen in the small group market specifically?
Sure.
So
why would it not? And let me put it that way. Why would it not occur?
There's been a lot written about what will happen to offer rates. Employers offering to their employees in the employer-sponsored market altogether, and in the small group market in particular, and a lot of predictions about what is going to happen. I think that most, as has been pointed out today, most employers offer coverage to their employees because, number one, they think it's the right thing to do, and number two, they think it helps them recruit better employees.
Okay, is this a likely scenario then? You got 12 employees, one of them gets a serious illness, and in order to not wreck your rate, that person drops out and now has to go on their individual plan, which obviously, because there's no pre-existing conditions with the new President's health care law, they will be able to get coverage. And obviously then you have adverse selection because obviously all the people then who have problems are going to be in the pool.
Well, but the person getting sick, I think that's the point I've been trying to make. The person getting sick can't wreck your rate anymore under the Affordable Care Act because rates cannot be based on health status. They can only be based on age within certain boundaries and location, but not on health status. So this will make it easier for employers to maintain coverage for their employees because they won't have to worry about rates going up.
Okay, so that individual is going to be retained then in the health care group, and therefore, because of the ability to continue to provide care for that person, it's going to be more costly, right? If they got a serious
illness, when people get sick, they have more health care costs. But
sure.
What happens under the Affordable Care Act now is we're creating a single risk pool so that any particular insurers, all of their employees, all of their small group insureds are in one risk pool. So what we've done in essence is we've made the small group market look a lot more like the large group market. And the large group market health insurance has been less costly, and it's been more stable than in the small group market. So we're creating a larger risk pool to spread the risk so that the burden of that employee getting sick doesn't fall just on that employer, but it's spread across the entire risk pool.
I see my time is up. Thank you, Mr. Chairman.
Mr. Rice.
I have a note here I just received a couple of days ago from an employer in my district who has 93 employees. He said his 2013 health care contract cost was $558,000. That his 2014 is $655,000, overall increase of $97,000 and 19.1%. And then the new taxes generated from Obamacare was an additional $44,341. So he is he's looking at an increase of about 30% when you factor everything in. And I don't know if he's factored in his individual taxes on top of that. So quite significant. I ran a law firm for 25 years before I ran for Congress, and we always carried major medical on our employees because we didn't want to be bankrupted by a catastrophic health event. We never carried insurance for dental or vision on minors, or mental or substance abuse. Never needed it. Never needed it that whole 25 years. And so the plan, Carolina Care Plan, that the law firm was on has been canceled because of Obamacare. And they're looking for another plan that they can buy that doesn't have those coverages. Can you lead me to one?
That doesn't have
those coverages. They just want a plain, bare bones major medical policy. That's what they need for their employees. Where can they buy one that doesn't cover substance abuse, mental health?
Those require assuming that their policy is not going to be extended pursuant to the policy the President announced a few weeks ago.
And it's not. It's not.
Okay, so then the substance abuse coverage, mental health coverage are part of the essential health benefits that are included in what's required by the Affordable Care Act. And I would say again, those benefits, which were determined on a state-by-state basis, they weren't determined nationally. Everybody had to have the same. They were determined on a state-by-state basis. In most states, they chose to use the benefits that were afforded by the most used small group plan. So in general, the benefits that are required for small group plans going forward are very similar to the benefits that employers were choosing to buy up until now.
Well, I was an employer. I didn't choose to buy it.
I understand.
You said it was done on a state-by-state basis, so some of the states don't have to carry all these outlying coverages. Is that what you're saying?
No, they have to provide the essential health benefits.
So they all do have to carry. So it is a
but
national requirement. It's not a state-by-state requirement. It's a national requirement.
But how the benefits were going to be offered in, what's in each plan within the essential health benefits was done on a state-by-state basis. But you're right, the categories of the 10 essential health benefits are mandatory under
So some states don't have to have certain kinds of mental health coverage and some do?
The particular benefits that are offered under mental health coverage vary, yes.
All right, so you're telling me that my old law firm, which I'm no longer affiliated, 15 employees, they're not going to be able to find a plan that is offered because these are required federal benefits.
Mental health and substance abuse are required as part of the essential
and dental
health benefits.
and vision for
pediatric dental
and maternity.
So
my 60-year-old law partner and his wife are going to have to carry maternity coverage.
We are spreading the cost of providing maternity coverage to women across the entire pool of people who are buying coverage.
That's a nice way.
That's insurance. That's how insurance works. Insurance doesn't work where you just pay for what you need. Insurance works where we spread the cost across everyone who is in that risk
Actually,
pool.
no, that you're wrong. Actually, insurance is where you choose to go buy the coverage you need, and you spread the risk among all the other people who need that coverage. Here, you're forcing people to buy things they don't need, that they clearly don't need and don't want. Isn't that right?
As we've discussed, maternity and substance abuse and mental health coverage are among the essential health benefits, yes.
Why would you force somebody to buy things that they clearly don't need and don't want? Well, I mean, explain that to me. What's the purpose of requiring a 70-year-old woman to buy maternity coverage?
The purpose is to make sure that all Americans have access to the health care that they need, and to spread that cost.
So you're saying a 70-year-old does need maternity coverage?
No, and to spread the cost of the
Oh,
health
they
care that
don't
all
need it. Why do they
Americans
have to
need
buy it?
among Americans. And I would submit to you, and I know you may not want to hear this, the employees of your law
You're
firm
right, I don't want to
don't know whether they're going to need mental health coverage or not. They have no way of knowing whether one day they will need mental health coverage or not. Or
I
they
can
will need
promise you that a
substance abuse coverage
70-year-old
or not.
woman will never need maternity coverage.
I understand that.
All right, I'm over my time. Thank you very much.
Mr. King?
Thank you, Mr. Chairman. I'm glad that I'm not sitting in that seat. The unpopularity of this atrocious law surely has to reflect itself in this discussion we're having here in the Small Business Committee today, and I thank the chairman for holding this hearing. I just think about some of the promises that have been made, and I wonder if there isn't a committee in the White House to make sure they're all broken. But I looked at my own policy, and I hadn't given it any thought till about October. I spent the previous 4 years fighting on behalf of the American people against this. And so then when I finally had really no choice except to be have to subject myself to this law, I began to read through the policies that were available. And it was awfully hard to get my hands on any policy. The most information I could find was from verbally over the telephone. But I'd remind you that 25% of the people in this country profess to be Catholic. I'm among them. And the teachings of the Catholic Church are this. The Catholic Church opposes contraceptives in these forms, birth control pills in that form, and sterilizations, abortifacients, abortion-causing pills, and abortion. And the legislation requires that at least a policy be offered for purchase so everyone in the country has an opportunity to purchase a policy that doesn't fund abortion. I find that it's almost impossible to find out whether that actually is the case or not. And of those offered to members of Congress, according to Representative Chris Smith, whom I trust above all others on this topic, is that there are 112 policies that are offered to members of Congress. Of those 112, 9 of them don't cover abortion. Of those 9 that do not, 8 are regional by Aetna, if those that apply to me at least, and there's only 1 available that doesn't fund abortion. So that was my choice. And I wondered if there were only 1 woman in the world, if I would marry her, sight unseen. But that's essentially what happens with this policy. Only 1 available to me. And then I look at it and I see that, no, it really isn't spreading the cost of across the broader universe here, because in the mandated contraceptives that are listed in this policy that I have in my hand, there is no deductible. And so that means that anything that you can get a doctor to prescribe is going to be no out-of-pocket cost to the person who utilizes that. And I'm pretty confident that the gentleman's reference to maternity coverage doesn't apply to a 70-year-old woman. So how do you reconcile that we have these mandated contraceptives here? 3 of them on this list directly violate the principle of the Catholic Church. And it appears to me, Mr. Cohen, that it's impossible for a faithful Catholic to buy a policy that doesn't violate their conviction.
So you've asked me a number of different questions here. With respect to the provision of contraception without cost sharing, there's a part of the Affordable Care Act that required a study to be done of particularly preventive services for women. An independent study was done which found that providing contraception to women without cost sharing had significant health benefits for women. And pursuant to that study and the provisions of the law, those, and there are a number of different preventive services, mammograms,
Funny, I didn't see that on here.
There are a number of different preventive services that have to be provided, and not just to women, because there are others, vaccinations and other things that have to be provided without cost sharing, because there's a very robust literature that shows that.
Let me, instead of just leaving it to wallow in that, you have to deal with the law and the policies it is and do the best you can to answer this. But let's just take this to this question. How does a faithful Catholic comply with this law and not violate their convictions?
Well, I really can't speak to the convictions of a Catholic.
But I have.
What causes them
and the convictions
to
of the Catholic
violate or not.
They oppose the contraceptives, the abortifacients, and the sterilizations, and the abortions. And the law says that a policy shall be offered to anyone, at least one policy that doesn't fund abortion. How do I know that?
So I actually can't answer the question of how people are able to find out the answer. It's a fair question.
But we have the mandate that we will buy the policy, or we will have the IRS come down on us and punish us with a tax that I guess is not a penalty.
Right.
And so how does a person comply with the law when the federal government's not complying with the law? And if they're not, I'm saying this.
Well,
they are obligated under Obamacare to make sure that there's at least one policy available that does not fund abortion. And I think it's important to the people on this panel and those that might be listening into this committee to know that there are three other basic principles here that are mandated violated by this legislation. That's the contraceptives, the sterilizations, and the abortifacients. They are mandated to be paid for by everybody, even the people that Mr. Rice is talking about, without a deductible, even though almost all the other services do have a deductible. It looks to me like this is a direct assault on people that are pro-life, especially Catholics.
So with respect to what you're calling abortifacients, I know the FDA has concluded that those drugs are not abortifacients, that they do not cause abortion. They prevent pregnancy, but they do not cause abortion. We can debate that, but I'm not a scientist. I just know that that's the conclusion that the FDA has reached. So that would deal with that
The contraceptive pills, there may be an argument there. I know the Catholic Church wouldn't agree with the argument you've made, even if we're talking about that. But the balance of these abortifacients, no, I absolutely don't agree. And so the vernacular that's used by the FDA to try to get around this sounds like a bunch that I've seen from this administration. But in any case, I think the point is made that the person's no longer free in this country.
Mr. Chairman,
you can't be, and I'll yield in a moment. But you can't be free in this country to follow your conscience or your religious convictions, because this law, as enforced by this administration, violates the deepest convictions of at least 25% of the people in this country. And I yield back.
Time expired.
Ranking member.
Yeah. Let me see if I could get back on track, because for a second I lost what this hearing is all about. Is about shop exchanges. But if I just would like to ask you if a Viagra is prescribed by a doctor, is that covered?
It depends on what the particular insurance policy, whether it's included in the drugs that are covered by the policy or not. I mean, that's an insurance company's decision.
Okay.
Viagra is not a preventive service that's mandated by the Affordable Care Act.
I'm glad to know that. Mr. Cohen, let's talk about the states that have chosen to run their own exchanges, while others have declined. We are seeing some great results in the state-based marketplaces, especially in New York. And in fact, numbers were given here. And I know that the only numbers coming out from New York is the one that were provided by the insurance commissioner from the state of New York, who said that they have approval rates for 2014 that are at least 50% lower on average than those that are currently available. But we do have some numbers coming out of some states that are related to small businesses. In the 6 states that have made information available in the small group market, proposed premiums are estimated to be on average 18% lower than the premium a small employer will pay for similar coverage without the Affordable Care Act. Would you say that this is the type of trend that we will see coming out of other states?
Yes, I agree with that. I mean, again, I think it's important to bear in mind that insurance markets do vary dramatically from one state to the next, and so we can't generalize, from New York's experience to where there is a very competitive market and a lot of carriers offering coverage to some other states where there is maybe only one or two. So I think over time, I would expect that the example of the states that have established their own marketplaces and been successful will encourage and inspire other states to do the same. And what they will find is that the Affordable Care Act and the way that we have implemented it gives states a tremendous amount of flexibility to operate the marketplace in the way that's best for the residents of their state and give them the opportunity to retain control of regulation of the insurance market, which traditionally has been a state function.
And what role can you play to replicate the success that we're seeing in New York, where nearly 300,000 have completed applications and almost 100,000 have already enrolled?
So that's a great question. So we actually work with all of the states to help them if they're interested in moving towards becoming either a state partnership marketplace where they operate some of the functions, including the outreach and review of plans to be offered on the marketplace. We receive and review and issue grants to the states to help them establish state-based marketplaces, and then we work with them all through the process of developing the marketplace. So just as an example, in Mississippi, the state decided to operate the small business, the shop marketplace, although not the individual marketplace. And we worked very closely with the Insurance Commissioner of Mississippi to help that happen. And that state-based shop marketplace is going to be opening for business very soon.
Here in this committee, we always talk about the importance of having stability and certainty for small businesses. And that is so because when they put together a business plan, they need to know what they're confronting and what type of resources will they have available. My question to you is, what effect the threat of cuts had in the implementation of the provision of the Affordable Care Act by your agency?
Well, I would say, as with any government agency, we do the best we can with what we have. And while it would always be helpful to have more resources, and I think particularly the Secretary has spoken very, clearly about the benefit of having additional resources to do more outreach, to be able to do more education, to be able to make sure that every single person in the country and certainly every small business owner in the country knows what the law, the benefits that the law can provide to them, and knows how to take advantage of them. That has been difficult, given the funding levels that we have.
Thank you very much. Thank you, Mr. Chairman.
Absolutely. Last question. Document service last week that CMS, that you all knew as far back as July 26th, that the federal shops weren't going to function, or at least the website wasn't going to function. It was going to have to be delayed. In fact, we had a GAO study that was requested by this committee that determined there were significant challenges. Nevertheless, CMS continued to promise the public and Congress time and time again that the exchanges are going to be ready to go. Or at least the shops were going to be ready to go for that October 1st launch. My question is real simple. When did you find out that that it was nowhere near operational, you weren't going to meet the deadline?
So it was sometime well into September when we knew that the shop functionality would not be available for October 1st. I would just say, Congressman, I mean, you know, none of us have been happy with the way that the website rolled out. I mean, the President has said he's not happy. The Secretary is not happy. Ms. Tavenner is not happy. I certainly wasn't happy. We pushed really hard to get everything ready and up and running for October 1. It became clear at some point well into September with respect to the shop that we just weren't going to make it, and that's what we announced.
When was Administrator Tavenner informed?
Well, when you say informed, I mean, I think it was a process of pushing and trying to see what we could get done, and then there came a point in time when a decision had to be made. You know, are we going to be able to do this or are we not? And that was sometime well into September. I don't know the exact date, but it was sometime well into September when that decision was made.
So, but you don't know when the Administrator was informed or knew for a fact that this was not going to happen?
I don't have a specific date for you, but I know it was at some point into the month of September.
Well, the frustrating part is, and again, it goes back to that predictability and stability with you know, small businesses not knowing. It is frustrating too that, you know, an administration that wants to talk about how small business is so important to them, you know, why they waited until the day before Thanksgiving to announce that you know, that online enrollment, or they were going.
Oh, and let me, I'm sorry, Congressman, I didn't mean to interrupt you. There were two issues. What I was talking about in September was we announced it wouldn't be ready for October. Then we announced later that it wouldn't be ready, you know, at all this year. And that decision wasn't made until very close to the time that it was announced. We continued to push and hope that we were going to get that ready and be able to roll it out by the end of the month. And then, you know, sometime near in time to when we announced it, we just realized that given all the work that needed to be done to make sure that the website was functioning effectively for people in the individual market, that we just had to make a choice, and that's what we did.
Well, that actually makes my statement better than I could have. Again, I want to thank you for coming in today and for testifying before our committee and making yourself available, obviously, for questions. You know, to say that the implementation of the health care law has been problematic is an absolute understatement, and that is unfortunate. But the creation of the shops exchanges were supposed to simplify and provide affordable insurance options for all small businesses, but instead their implementation has become a game of hide and seek, and nobody has won with that. With that, the committee is going to we're going to remain active on this issue and provide some oversight in some of these key issues. And with that, I'd ask unanimous consent that members have 5 legislative days to submit statements and supporting materials for the record. Without objection, that is so ordered. And with that, this hearing is adjourned.